Representative Moore. Aye. Representative Sure. Aye. Representative Watkins. Aye. Representative Walton.
Aye.
Representative Wilk.
Aye.
Representative Wood.
The chair now recognizes Representative Ingalls for opening comments on House Study Bill 653.
Thank you, Mr. Chair. There is an amendment.
There is an amendment. The chair recognizes Representative Ingalls for opening comments on Amendment 2509.
Thank you, Mr. Chair. So the amendment is a strike after, and I'll talk to basically what the bill does. There were changes made in the strike after to accommodate concerns with the original bill. What this bill is establishes a new legal process for care facility placement decisions for adults unable to consent and without an available representative. It creates a priority order of individuals who could consent, including the patient's spouse, an adult child, parent, or an adult sibling, and that's kind of where I'm at with that.
Is there any discussion? The chair recognizes Representative Eller.
Thank you, Mr. Chair. We are still reviewing the amendment. It does seem to, I wrote down a lot of the questions that were brought forward in subcommittee, and it does seem to address a lot of those. We're still trying to compare the two and still have some questions. We're not sure it addresses everything at this point in time. But I would say, I'm going to speak on the amendment and the bill since this will become the bill. I think the amendment is a good step forward, so probably a yes on that, but I recommend my caucus vote no on the bill until we can continue digging through it a little bit more.
Is there any other discussion? Chair recognizes Representative Ingalls for closing comments.
I understand their position with not being able to get through and compare. There were several changes in the amendment, but it makes it a much better bill. So move the amendment.
Representative Ingalls moves Amendment 2509 short form. All those in favor say aye. Aye. All opposed say no. The amendment passes. We're back on House Study Bill 653 as amended. Is there any discussion? Seeing none, the chair recognizes Representative Ingalls moves House Study Bill 653. The clerk will call the roll.
Representative Harris.
Aye.
Representative Barker.
Aye.
Representative Wessel Crochell.
No.
Representative Bath.
No.
Representative Bergen.
Aye.
Representative Bradley.
Aye.
Representative Brown Powers. Representative Ellert.
No.
Representative Gelbach. Representative Ingalls. Representative Craig Johnson. Representative Rob Johnson. Representative Meyer. Representative Moore. Representative Turek. Representative Watkins. Representative Weldon. Representative Wilburn.
No.
Representative Wells. Representative Wood.
The vote 13-7. House Study Bill 653 will move to the floor as a committee bill. The chair now recognizes Representative Wood for opening comments on House Study Bill 704.
Thank you, Mr. Chair. House Study Bill 704 deals mainly with abortion-related drugs and the penalties for mailing, dispensing without license, etc. With that, I'm going to recommend we move to the amendment first before we make any other opening comments, as it would change the bill.
There is an amendment. The chair recognizes Representative Wood for opening comments. Amendment 2544.
Thank you. This amendment came to us from a variety of folks in our medical related fields, doctors, physicians, pharmacists. A lot of folks requested some of these changes. Essentially, the main gist of it is that it adds pharmacy to the healthcare setting definition and also the licensee related pieces thereafter. It also clarifies the civil cause of action and who that applies to when dispensing a drug outside of a care facility, and also as that applies when someone's dispensing it and is not a licensee in Iowa, and changes the statutory damages of that portion. So after having conversations with those medical related folks, they asked for their normal process with their Board of Medicine, Board of Pharmacy, boards of healthcare related items to be the process in which in any incident they would be conducting their business through their regular board process, and only unlicensed folks would be subject to the other penalties outlined in the bill. Those are my opening comments for the amendment.
Is there any discussion? The chair recognizes Representative Wessel Crochelle.
Thank you, Mr. Chair. Would Representative Wood yield to a question? Sorry.
Yes, I will.
So I have a couple questions, and thank you very much for working with the medical community, because I think this does make it a better bill. But I do have a question. I think there might be an error, or I'm just not understanding how this is written. But on page 7 of the bill, it says a person who dispenses an abortion-inducing drug in violation of this chapter shall be civil. Does it change it to shall be civilly liable? Correct. And so I believe in the bill it says that it is only a physician that can dispense.
Yes, and that is congruent with the rest of our abortion-related code section.
Okay. And then if you look at your amendment, so it changes it to civilly liable, and that's great. I appreciate that. It makes it a much better bill. But I think it's number 4 on the amendment. It says after inserting a person who is subject to licensee discipline under Chapter 148 or 155A shall be immune from civil liability under this section.
Yes.
So
to explain that further, we outlined what the civil liability would be for anyone not dispensing this properly among these guidelines, and it is saying that's the portion where I was referring to in any incident where a person who is licensed in the state of Iowa is involved in one of these situations, they would be answering to and having those conversations with their regular board that they would answer to for any other related incident among their licensee and practice. So that
this
outlines
is a license issue?
So
it becomes
it
a license
exempts
issue?
them from the civil liability because their board has a process for incidents already.
All right.
Does that make sense? And they requested that it be among their normal process.
And I appreciate it. I'm just not sure that it's written the way that it's intended, so maybe there's an opportunity to work on it.
Okay.
But I do think I recommend a yes vote on the amendment.
Okay. Yep, happy to hear feedback about any tweaks language-wise. I don't want to put words in your mouth. It sounds like we're on the same page as what we wanted it to say potentially, and that we just need to make another language tweak. So.
Is there any other discussion? Seeing none, the chair recognizes Representative Wood for closing comments on.
There is more discussion.
Oh, is that, oh, my apologies.
We are back on the bill.
No, we haven't
Oh, I'm
amendment.
sorry. I apologize.
Is there any other discussion? Seeing none, the chair recognizes Representative Wood for closing comments on 2544. Representative Wood moves amendment 2544. All those in favor say aye. Aye. All those opposed say no. The amendment carries. We're back on House Study Bill 704 as amended. Is there discussion? Chair recognizes Representative Bader.
Thank you, Mr. Chair. Would Representative Wood yield for a couple questions?
Yes.
Thank you. Going to the informed consent process, it's outlined on page 2 and 3 of this bill. Specifically, top of page 3, I have a question in which as part of that informed consent, it says it must be stated that it may be possible to reverse the intended effects of a chemical abortion. Wondered if you could educate me on kind of medical standards right now in terms of what we know on reversing medical abortions, because to my knowledge, this is not an established practice.
Yeah, I think that you might have more colleagues you could reach out to. I would say that in your profession as a whole, being a physician, I have had a lot of different physicians on both sides give you feedback on this piece, and also have looked at a lot of studies that have been conducted on this related piece. So essentially this is just, this language is just saying that information that it exists would be available to the patient in question.
And how is that helpful to the patient?
I think anyone who who is going through a medical situation of any kind would probably like to know all of the information that is out there about different aspects of their procedure or medications. And I would say that this is helpful in letting someone see the full picture of the information that is out there related to abortion pills and reversal methods that are being tested, being discussed, being studied at this moment.
And because my interpretation would be, in case you're not sure, there may be a way to reverse this, is what I'm seeing in here. If somebody were to make this decision, would you want them to be pretty sure about that decision, or kind of on the fence before taking that pill?
I obviously could speak to what my feelings on if somebody asked me this question would be. I think you have to talk to women who might be going through a pregnancy, might be going through the aftermath of a pregnancy-related situation, whether it has resulted in a happy, healthy baby, or if there were any complications. You might want to ask some of those women about feedback of, if they had chosen to take an abortion pill, would they have wanted to know all of the information that was related to a reversal? I can, if you'd like me to answer how I would say, I've never been through an abortion, but I would say that I would like to know all of the information that was out there, as I stated before, about any related topics. For example, if I went to my doctor and was having a conversation about any other medical related situation, let's say I was diagnosed with cancer of some kind, right? And I said, if I go forward with this method, can you tell me what all of the related knowledge that you know of that is out there, whether you agree with it at the moment or you're still researching it at the moment? I would want them to provide that with me. Maybe they say, I've heard it's kind of crazy, but an avocado a day seems to work for some people. I actually heard that from a guy, so I'm not trying to make that up. It was not medical advice that he was able to share, but he said it had worked for him because he had a diagnosis, and whether that worked for him or not, that was one thing. But I would also want them to tell me about all of the ongoing studies, all of the clinical trials, all of the out-of-the-box drug regimens that were being looked at right now. I would want my doctor to at least provide me, if not counsel me. So at the minimum, provide me with a handout that explains different things that are going on in that discussion right now.
Thank you. And if that doctor did not actually believe it was possible to reverse a medical abortion, do you think they should be required to still say that anyway?
Yeah, I think that's a really good point. And if you look further on, it shows where the informational materials would outline what could be provided here. So this could be something that was just in your, I think you alluded to it. It's down on that same page, line 19. So for example, a website, it could simply be in your informed consent package, and you would not have to verbally be counseling on something that you did not agree with. Again, it would just be
have to be in writing.
It would just have to be something that was available to the patient in their
That they have to
informed
sign.
consent package.
That they have to sign.
That they were aware that they saw the material.
Okay.
They don't have to utilize it, just that they were given the option to see it.
The fine print. Thank you. I was hoping to hear why that particular part was included in the informed consent. The current studies, to my knowledge, so I didn't know if there was more out there. There are two major studies in majors, maybe a misnomer, on the reversal of medical abortion. One is a case series of 6 patients. 6 patients. Most of the data that guides us, the other is a study of rats. Most of the studies that guide us are the standard of care medicine involve more than 6 patients and a bunch of rats. That's why I'm concerned about this, is I don't know of other places in medicine where doctors are required to give a patient a sheet of informed consent that's based on a study of 6 people and a few rats. And for a state government, a bunch of politicians saying that doctor needs to, at least in writing and fine print, be betray their medical expertise, their code of ethics, to be honest with their patient and use their best medical and scientific advice on what is and is not possible. That is now being dictated by politicians and getting in the way between that trusted relationship that a patient asks to have with her doctor. Really makes this specific part of this bill pretty egregious. I will leave it at that. I'm going to recommend a no vote on this for that, among other reasons.
Chair recognizes Representative Wessel-Kroschel.
Thank you, Mr. Chair. I think it's clear that this bill is not about safety. It is about control. It's about controlling our medical community, and it's about controlling, even more troubling, about controlling women and their lives. Doctors already follow medical standards. They already screen for abuse. They already obtain informed consent. This bill declares that politicians know better. Today in subcommittee, I had the opportunity to cede my time to a very well-known obstetrician here in Des Moines who gave us compelling information. As a leader, I believe we listen to the experts in their fields and we lead accordingly. What we should all be focused on is the loss of honest, scientifically based care for pregnant women. Under this bill, a doctor's career can hinge on how a politically appointed board interprets a conversation. It forces doctors to deliver contested medical claims or risk punishment. That is not patient care. It is forcing doctors to lie to their patients. I can't be more clear. It's a lie. House Study Bill 704 makes abortion care harder to access, expands state tracking of miscarriage outcomes, and pushes abortion care out of state. I will not be supporting it. I recommend a no vote. Thank you.
Is there any other discussion? Seeing none, the chair recognizes Representative Wood for closing comments on House Study Bill 704.
Thank you, Mr. Chair. I want to start by saying thank you to everybody who has participated in a very robust conversation over the last several days and today. I just want to outline a couple things in this bill that I don't think are getting a lot of conversation because I don't know. I guess they're not haven't been part of the flashy pieces to some folks. I want to note the pieces in the beginning sections of the first page of the bill that really outline so many instances where we've made sure to overly protect the availability to important medications for medical emergencies. In the case where a woman is, unfortunately has had a miscarriage and needs help with taking a medication that would help her evacuate other, harmful pieces of her baby that are left in her body. This medication that could be used for that is still available to her. We have talked about the, legislation that is related to the risks of taking these drugs. All of that information was taken directly from the drug label. So there is no misinformation there. That is not lying. That is making sure somebody understands what is potentially going to happen, and at minimum, a pharmacist in giving you your consultation would be legally required to counsel you on some of the risks and warnings that are associated on that label. I want to state this too. This does not change any of the timeline for accessing these medications legally, and it does work in legality with our current heartbeat bill. This is not changing any of the timeline for access to legally acquire this medication from a physician. I think that it's been interesting. We've heard a lot about coercion and a lot of the ways that folks are currently accessing these drugs, unfortunately, is through unlicensed black market access points. And I hope that today, through all of the discussion, we can all see how taking a pill that you do not know who has manufactured it, where it has come from, if the person on the other end of a consultation where you cannot confirm their medical licensure, their expertise on this matter, could be harmful to a woman. And I think it is important to make sure that we are protecting women from illegal, unlicensed black market drug pushers, if you will. And I also want to note, as I already alluded to during my conversation with Dr. Babe, you know, in times of extreme medical emotion, stress, consultations, potentially diagnoses, I personally would want to know the full picture of the conversation that is going on in the medical community right now. I think that there's probably some disagreement still amongst that, but my goal here is to simply make sure that a woman has all of the choices, all of the information that is about this conversation in front of her. My goal is to simply allow her to see the full picture of what any step going forward from now would be like, and I support her right to have that valid access to information. So again, I just want to thank everybody for the conversation today, and with that, I move this bill.
Representative Wood moves House Study Bill 704 as amended. The clerk will call the roll.
Representative Harris.
Aye.
Representative Barker.
Aye.
Representative Wessel Crochell.
No.
Representative Bates.
No.
Representative Bergen. Representative Bradley.
Aye.
Representative Brown Powers.
No.
Representative Eller.
No.
Representative Gelbach.
Aye.
Representative Ingalls. Representative Craig Johnson.
Aye.
Representative Rob Johnson.
No.
Representative Meyer.
Aye.
Representative Moore.
Aye.
Representative Turek.
No.
Representative Watkins.
Aye.
Representative Weldon.
Aye.
Representative Wilburn.
No.
Representative Wills.
Aye.
Representative Wood.
Aye.
Bergen.
Oh, okay, I'm sorry.
With a vote of 12 to 8, House Study Bill 704 will go to the floor as a committee bill. We have hit our block, and we will be coming back after the Judiciary Committee adjourns.